Hello, my name is Ashton Simmons, and I am the Care Coordinator for Ascension St. Vincent, Indianapolis. Welcome to today's presentation, going over the importance and impact of care coordination and the role you play as nurses. Let me tell you a little about myself. I have been an RN for 6 years with a background in trauma neurocritical care and post-anesthesia care. I am so excited to be stepping into the role of care coordinator and look forward to working with you all. Now let's begin. Healthcare is moving from an acute illness-based approach to community health services which make emphasis on preventative care and promotion of healthy lifestyles. Fluminigan and Gaffini, 2020. Care coordination is vital to this change of direction, as it incorporates healthcare providers and patients towards successful treatment, lifestyle changes, and preventative measures, which leads to improved patient experiences, satisfactions, and outcomes. In today's presentation, we will be discussing care coordination in regards to effective strategies for collaboration, the impact of change management on patient experience, the rationale behind coordinated care based on ethical decision-making, identifying potential influences on healthcare-related policies and provisions, and most importantly, the role we play in the coordination and continuum of care. What is care coordination? Care coordination is a collaborative process to help patients obtain optimal health and appropriate social and life support resources that meet their unique needs during their lifetime. Fluminigan and Gaffini, 2020. Nurses act as a mediator between different healthcare providers and patients to facilitate proper coordination and continuum of care. Interdisciplinary collaboration and communication, patient-centered care, and providing community and social resources promotes improving patient and family engagement and self-management of their health, which is a driving force behind positive patients' experiences and outcomes. Next, let's explore effective strategies for collaboration with patients and families. The Agency for Health Research and Quality, AHRQ, defines shared decision-making as a collaborative process that includes patients, families, and healthcare providers making informed decisions. Consideration must be taken to include patients' values, goals, preferences, and circumstances to address any potential barriers to effective care. AHRQ 2023. One such approach is the SHARE approach. First developed by AHRQ in 2014, it's a mnemonic for seek, help, assess, reach, and evaluate. Healthcare providers must seek patients' participation in care by encouraging them to actively contribute to their care so they understand choices exist for treatment and can make informed decisions. Help your patients explore and compare options for treatment by having discussions with them about potential benefits as well as the harm that may come with treatment options. Assess their values, preferences, goals of, and potential barriers to treatment by being considerate and respectful of what matters to them. Reach a decision with their participation by making a collaborative choice based on the best option for the patient and assist with scheduling follow-up appointments. Lastly, we must evaluate the decisions with the patient by monitoring the progress of care and revisit decisions as seen fit. By incorporating patients and families in the options and decisions of their care, it leads to a greater outcome for the patient. How many of you have used patient experience and satisfaction interchangeably? You're not alone, so let's clarify the two. According to the AHRQ, experience refers to the range of interactions patients have with their health plans, healthcare providers, hospital staff, etc. AHRQ 2016. Satisfaction, however, is whether a patient's expectations were met during their care. AHRQ 2016. Change management models can have significant impact on patient experience and ultimately satisfaction. According to a systematic review of change management models, it is noted that adaptability to change is crucial to modern health services in order to meet the ever-changing needs of our population. Harrison et al., 2021. Management is described as the process of making things happen, and leadership as the development of a shared vision. Effective leadership can create a psychologically safe and empowering work environment. Transformational and relational coordination leadership strategies both foster environments of self-awareness, confidence, and the empowerment of frontline staff to engage in change. The American Nurses Association's 2023 article on transformational leadership finds that transformational nurse leaders build a culture of respect and open collaboration. This culture empowers all staff to identify areas for improved practice and come forward with collaboration ideas. This encourages a much-needed shift from a top-down change management style to a bottom-up approach, which includes all staff being able to have a voice. Relational coordination is described in Stuckey et al.'s 2022 article as a strategy that improves relationships and communication between interdisciplinary teams, which leads to a healthy work environment. The theory suggests that interprofessional collaboration and communication are most effective through shared goals, knowledge, and respect. With a healthy work environment, healthcare providers can properly incorporate their patients into the care coordination process. As we have heard previously, bringing patients being involved in their care can lead to improved patient outcomes and experiences. Evidence suggests when utilizing change management models, those affected by the change are more likely to commit to and welcome change when they are contributors and understand why and how the change will improve patient and/or staff environment and experience. Harrison et al., 2021. An observation made of organizations with supportive change culture includes co-design efforts, a method of meaningful engagement about changes including staff, patients, and caregivers. Co-design approaches offer one method through which change management, improvement, and implementation can be integrated to create change for quality improvement. Harrison et al., 2021. Through improved efficiency and enhanced communication and increased staff morale, patients can have more positive experiences with the healthcare system. Change management can be utilized to foster patient-centered care, such as co-design effort and shared decision-making. Streamlining processes through technological advancement and improved staff training can minimize potential risks for errors, improve efficiency, and ultimately cost. Let's discuss rationales for the coordination of care based on ethical decision-making. The Center for Medicare and Medicaid Services, CMS, emphasizes that the lack of care coordination can result in negative outcomes for patients, unnecessary tests, increased use of emergency care, poor transition of care, medical errors, and non-compliance with treatment plans. CMS 2023. Subjecting patients to unnecessary tests, procedures, and care violates the ethical principle of non-maleficence or do no harm, which potentially exposes them to risks without benefit. Shared decision-making is based in respect for the ethical principle of autonomy or self-determination. Galletta et al., 2022. Patients have a right to understand treatment options and have enough information to make an informed decision about their care. Patients also have a right to fair and equal treatment regardless of their background. By incorporating patients' socioeconomic, psychosocial, and cultural backgrounds into care, nurses can uphold ethical and principle of justice. Now we will identify potential influences of policies and provisions on outcomes in patient experiences. Enacted in March of 2010, the Affordable Care Act provided significant reform to health care with three primary goals: to make healthcare insurance accessible and affordable, particularly to those living below the poverty line, by offering premium tax credits, expand the Medicaid program to reach more people below the poverty line, and support innovative care to decrease the general cost of healthcare. Department of Health and Human Services, no date. States have a program called the Health Information Exchange. Health information exchanges allow healthcare providers and patients to access and share vital medical information electronically, which can lead to improvements in speed, quality, and the cost of patient care. Timely sharing of information can help to better advise decision-making. Office of the National Coordinator of Health Information Technology, no date. It ensures everyone involved in a patient's care has access to the same information, helps facilitate coordination of care, and reduce duplicate tests and treatments, leading to decreased health-related costs. When patients have access to their information, it encourages their education and involvement in their health care. It also promotes effective and efficient treatment by providing healthcare providers with clinical decision support tools. The Health Information Exchange is the backbone of technological communications to influence national and state-led initiatives. Office of the National Coordinator of Health Information Technology, no date. As we have learned today, healthcare providers are integral into the coordination and continuum of care. However, nurses play several pivotal roles. We are educators by teaching patients, promoting engagement and shared decision-making. We are advocates for our patients and remove barriers affecting access to care and successful treatment while using moral and ethical standards in our practice. We develop vital data which is used to come up with coordinated care plan based on shared decision-making. We monitor patients for symptom progression and potential side effects. We share information with both patient and other healthcare providers, and at times act as a mediator between the two. Lastly, we provide psychological support to both patients and families to help promote participation and self-management of care. Galetta et al., 2022. Nurses are change agents and leaders. They must work to shift the healthcare model in the United States from the outdated acute care model to one based on prevention and health promotion. Quoted from Fluminigan and Gaffini, 2020. We can and must make a difference through research and innovation to remove barriers to care and assist with access to needed services. I hope you've enjoyed this presentation and have learned a little more about care coordination and the impact it can have on patients' outcome and experiences. Thank you for your time and have a wonderful day.